Lynda, thank you so much for joining us today to tell us a bit about your experience with neuroendocrine cancer. Um, I'm just going to ask you a few questions and then we'll see how the conversation flows. Um, so, firstly, could you tell us about the process of being diagnosed with NETs?
Yeah, look, I was diagnosed in 2010. It's funny that, the mind isn't so good these days, but I remember that almost to the second when it actually happened. I think that's probably relevant for anybody with a cancer diagnosis. And I had I was working full time, and there was some gastric went around at work, and I had a bit of a pain, and I thought, I'll just go to my GP and have it checked. And my GP wasn't on at that particular time, and I saw another doctor in the practice. And she said to me, look, I want you to go and have a blood test, which at the time I thought, well, that's probably a little bit of overkill, but I'm so glad that I did have the blood test because it actually showed that my liver levels were really high. She actually rang me and said, I want you to have an ultrasound. And I can remember at work saying to them, look, I don't know if I'll go and have it. And they said, look, I think you should. So I did. And that's when they found that I actually had a mass in the pancreas. And I went back to her on the Saturday morning actually to get the results, and thinking it was just gastric, I said to my husband, look, you don't need to come. I can just go on my own. It's fine. And she sat me down and opened up the report on the computer. And I can remember clearly the first few words were, there's a mass in the pancreas. And probably from then, everything was a bit of a blur. She said to me, look, we'll be in touch next week, but, go away. And there was no comforting or anything. And I went out to the car and sort of burst into tears and got home, and that night was very difficult. And the next morning I woke up, it was a Sunday, and I thought, I can't handle this. And we went to our local hospital, and I'm not sure what I thought that they could do, but fortunately the receptionist was used to work at my doctor's, and she said, look, we'll find someone that is really caring and they can have a chat to you. And we had this wonderful doctor at the hospital who actually spent the whole day with us and arranged for me to have a CT scan. And later in the afternoon when we got the results, he sat down with us and went through it and explained what was showing on the scan. And I remember saying to him, how long do you think? And he said, look, it's usually very quick. And so we went home, and but I was fortunate actually that he actually rang the surgeon on the Sunday afternoon at home and organised for me to see the surgeon on the Monday. Obviously, at that stage, he wasn't sure what was happening, but sent me to an oncologist who then arranged for me to have scans and biopsies and things. And my biopsies were actually inconclusive. So I had 3 separate attempts at biopsies, and they couldn't get a definite diagnosis. So they assumed that I had pancreatic cancer. So with that, I was told that I had only 4 to 6 months to live. And I started weekly chemotherapy. And I also started taking a growth inhibiting tablet that had some really nasty side effects. The chemotherapy I was on for 15 months and the tablet for 2 years. And I had CT scans every 2 months. And when I had my CT scans, I always made sure that I had the same radiologist read my scans so that we could try and have that continuity. One particular day, he was away, and a different radiologist read the scan and said that my tumours had actually increased. So the oncologist I was seeing at the time wanted to take me off all my treatment and put me on another form of chemotherapy. And I didn't really know much about this, but I was really lucky that the chemotherapy unit that I went to the nurse there pulled us aside and said, do you know what this treatment will actually do to you? It will change your quality of life. And I was working full time. You won't be able to work. And luckily, she suggested that we go and get a second opinion, which we did. We went to Sydney and saw this amazing oncologist up there who spent an hour with us going through all our scans. And she said, look, you know, I don't think this is pancreatic cancer, but I think these are the steps that I think that you should probably do. We went back to Canberra, which is where I live. And it was really difficult, really tough to have that conversation with my treating doctor there, that these are the steps that we would like to take. And I had another CT scan which was read by the original radiologist, who said, no, it hasn't grown. It's still exactly the same as what it was. And we then looked around for different things that it could be. And Simon, my husband, looked on the internet and saw about neuroendocrine cancer. And we really had to push to get the scan, the gallium-68 scan, and that came back that I had the receptors and that it was neuroendocrine. And at the same time, I'd actually had a gastroscopy as well, and I asked them to do another biopsy, which stained for neuroendocrine as well. So that's how we actually came about with the neuroendocrine diagnosis. So from my original cancer diagnosis to getting the neuroendocrine was 2 years. And it was such a relief to get that, because we had been living basically every 2 months wondering if that scan was the one that was going to say, well, you know, this is it. And so it was a difficult journey to get there. And but, you know, I'm in a really good place now with my diagnosis. I've got a fabulous team working behind me. Once we had the neuroendocrine diagnosis, we wanted to see a NET specialist team. Unfortunately, I couldn't get that referral from my team here, so my GP did all my referrals to the NET specialist team, and they're a wonderful group of different specialities that look after me, and I know that they're there if I need them. And I'm so confident now in the treatment that I'm receiving, and I'm treated like a person. I'm not a number, and you know, I'm in a really good place.
Lynda, can you tell me how old you were when you were diagnosed?
I was 48. Yeah, and it just came out of the blue. You know, had two sons, 19 and 22, and I was working full time, and we're in a really good place.
Lynda, can you tell me about your personal reactions when you heard that it was a mass, and also what your reactions were when you heard that it was neuroendocrine cancer?
Yeah. Obviously, when I went for the original appointment and heard that there was a mass in the pancreas, it was I don't know if I really had a reaction. It was probably more I was a little bit numb and a bit stunned. Couldn't process, because it hadn't been on my radar that it could even be cancer. So I don't think I could really process what was going on. And it was, you know, and I think probably it wasn't until I'd actually been to the hospital the following day and spoke to them, and they said, look, you know, that the time frame that I may not survive and that it may be very quick, actually that's when the fear started. And I'm the type of person that actually always takes other people's feelings into account, and I think I spent a lot of time thinking, well, you know, how am I going to tell my kids? And then how am I going to tell my parents? You know, I had one son living interstate, and I had my parents interstate as well. And that was probably the thing that was concerning me the most, and of how I was actually going to broach the subject with them, because especially my son in Queensland and my parents, I wasn't there to give them a hug. And but then in the same boat with my parents, I also felt like I couldn't talk to them at the time, because the thought of actually giving them that news was devastating to me, because I knew how that they would react. And so I was very lucky that my brother, actually, who lives in Melbourne as well, actually went and spoke to them. So that took that pressure off me. But it was a couple of days before I could actually talk to them, and that's probably something that I do regret, because I know that they wanted to talk to me, but I just felt that I couldn't trust my own emotions at the time and didn't want to upset them. So, and it was probably, I almost went into automatic. We had multiple weeks of multiple appointments and being pulled from one place to another. And I think, I don't think I really actually thought anything. It's, I'm so lucky that I had my husband Simon with me, because he did most of the talking, and I know that he was hurting so much as well. But I was just in this daze, and really couldn't take in the information. I think I just focused, when you're told, you've only got 4 to 6 months, I think I just kept focusing on that. And it was almost at the time like I had been written off, that yes, I had this, and that I, it was recognised that I wasn't going to be here for very long, and I felt that's how I was being treated as well. And so I think I shut down. And so that was, it was a really difficult time. And I think also going through that for so long, for the 2 years, with that constantly hanging over your head, that you had pancreatic cancer, and that it could happen at any time. And that was really difficult for those 2 years, going through that. And you'd see people and they'd say to you, "Oh, you're still here." And it just kept coming back to you that, you might not be here. And I think, I did things like, we bought a lounge, and Simon said to me, "What colour?" And I said, "Well, it really doesn't matter what colour I want. What would you like?" And for those 2 years, I lived my life like that. I had that thought in the back of my head, I'm not going to spend money on things for me, because, I'm not going to be here. So when we got the neuroendocrine diagnosis, we actually had a name. So it was such a relief. But I think the biggest relief that we had was when we, Simon, looking at the internet, came across what was then the Unicorn Foundation. It's now Neuroendocrine Australia, Cancer Australia. And I now had a group that I could actually get accurate information on that was relevant to Australia. But they had an event at Parliament House that we went to, and I met patients from across Australia, and we got to speak to John and Simone Leyden, the co-founders of the Unicorn Foundation. And I saw these people that had been living with NETs for 15 years or more. And I came away from that so uplifted, and it changed my whole outlook on life. I knew that I still had treatments and things in front of me, but I knew that there were treatments. And I can remember John Leyden saying to me, there's things that we can do. There's multiple treatments, and, you can see that people are living with NETs. And so to go from total devastation to this almost euphoria that there is someone out there that's looking out for us, and that there are people that are living with this disease for many, many years. So that was And since then, I mean, my whole outlook has been positive because I know that I have got that support system there with me the whole time.
So a lot of people talk to me about when they tell family and friends they feel responsible for, you know, almost guilty for the distress that they're causing, and responsible for caring for the emotional response from the people that they're talking to. And I know that in talking to lots of other patients, that's a really big burden, that it's they're dealing with their own personal responses to their diagnosis, but then they're almost having to step into the role of comforter for those around them. Can you tell me, was it like that for you? Can you tell me what it was like, if there was that for you?
I certainly, with talking to people and explaining my diagnosis, I was always mindful that how it would affect them, not only with my family. I was very, very upset about how this would affect my parents, and I think that also had an effect on me. But also, I was working full time, and when I went back to work after having all my scans, they had actually told all my work colleagues. I worked for a big government department, so we had quite a big section that I did have terminal cancer, and that I had only been given a short time frame. And I felt that people were avoiding me, and that was really difficult. So I actually got them all together and explained how I was feeling, and that I really wanted to try and be as normal as possible, and that, you know, I understood that they were confused and worried about what was going on as well, but to talk to me and ask me questions, and if I found that it was too much, I'd let them know, but I didn't want them sort of tiptoeing around me. And I found that I actually, one of the ways that I dealt with it, and I certainly didn't do this with my parents, but was to joke about things and to make light relief. I can remember going to Adelaide for work, and I was in the car with a colleague, and going back to the airport, and there was a turn off for hire cars, and then there was a sign that said terminal, to go up to the terminal, and I actually said to them, "Oh, we need to go that way," and I think that was a way of me trying to not make light of the situation, because it was a very serious situation, but to put them at ease as well. And as I said, I could not use that to my parents, but I found that I probably spent a lot of time trying to protect other people rather than dealing with my emotions. And it wasn't till later in my diagnosis that I learned that, you know, I did have to think about me as well, and be kind to myself, and to make sure that I had the support systems in place. So whether it was the Unicorn Foundation at the time, or seeing a psychologist, that I had those support there. And I think that's so important for patients to be able to talk to other people that are going through it as well, because we all understand what's going on. I went to a cancer rehab exercise class, and I actually still meet with some of the people from that, and we don't talk about cancer, but we all know what each other has been going through, and we know that if somebody's having an off day, that you know, we're there to support them. And I think that's probably one of the biggest things I had to learn, was to listen to myself and be kind to myself. And sometimes you have to be a little bit selfish and just take time because it is a grieving process, you know, and there are a huge array of emotions that you go through. And I think you just need to take time and let yourself go through those. And, you know, for me, I think that process actually brought me to a place where I'm in a, you know, I'm in emotionally, I'm in a good state, and I know there are people there if I need them. But yeah, I'm doing really well now. But I think you have to go through that grieving.
Lynda, you talked a little bit about the responses of those around you, and that particularly around your workplace, that perhaps people were avoiding you. I know there'll be people watching this video who are supporting someone with NETs.
Mm.
Do you have any advice for them? What can they say? What can they do? What was helpful for you?
I think just being there if the person needs to talk to someone, and I think after you've gone through that initial grieving, I think you just want to be normal. And one thing I did find was that having people, I was fine with people saying to me, you know, how are you? And that was good. But then I had other people that wanted to really delve down into and constantly ask me, you know, how are you going? And, you know, are you sleeping? Are you eating? Are you in pain? And that was on a daily basis. And I actually did sit some people down, my parents included, and actually had a talk to them and just said, look, you know, I'll let you know if if there's something going on and I need that support, but I want to try and be as normal as possible, you know, and I'll let you know when I have scans, and I'll let you know what the results are. But I just want to try and be really normal. And uh, and I was really fortunate that I think they were happy that I actually took that burden off them, because I think they felt, yes, I need to talk to her all the time and ask her how she's going, but deep down I think that they really didn't want to sometimes have that burden as well. And yeah, it's really difficult knowing how to talk to somebody that's going through cancer, because we all have different emotions, we all need different types of support. And but I think having to make that decision to actually let people know when it's getting too much for you, and I think they appreciate that as well.
So, can you tell us about some of the treatments that you've had?
Yep. So I had the 2 years of treatment for pancreatic cancer, but for my neuroendocrine, I've had PRRT. So I've had 8 cycles, so 8 treatments of PRRT. 7 of those were with lutate, and I had one with yttrium, which goes a little bit deeper than the lutate does. I 4 of my treatments, or actually 6 of my treatments, were because my tumours were progressing. And then the final ones were, I had some, even though my tumours were stable, they were actually rubbing on one of the organs and causing bleeding. And at the time, the specialists, the NET specialists and the surgeon in Melbourne suggested that I maybe have Whipple's surgery. But after discussions with them, they thought, well, we'll try 2 more treatments of PRRT and see if we can create some scar tissue between the tumour and the duodenum it was at the time. And fortunately it did. It created some scar tissue, and I haven't had a problem. So my initial PRRT was in 2013 and 2014, and my tumours have been relatively stable since then. There's slight activity in one of them, but it's not growing. And so that's been like that now for 6 years. And I'm just so grateful that we have the PRRT in Australia, and the expertise with the specialists. And so I've also had the SSA injections. I was on sandostatin for 3 years, And for the last 12 months, I've been on lanreotide. So I have those every month, and they're controlling the symptoms that I get. But I think that they've also, in some way, keeping things a little bit stable as well, which is great. For a time, I was also on daily octreotide injections for about 6 months, but I'm not on those anymore. The symptoms seem to be under control, so I'm not on those anymore, which is good. Yeah, that's really, as far as treatment goes, that's all I've been on at the moment. But I'm really lucky that it seems to be controlling my tumours, and hopefully that will continue. But I know, after talking to the doctors in Melbourne, that I may need some more maintenance doses of PRRT in the future, and there's certainly other lines of treatment that are available to me. So it's not something I do think about it, but I'm not concerned about it, because I know that I've got that fabulous team there, and that I do have other options available to me.
Thank you. Lynda, I'm going to ask you a bit more about PRRT.
Yeah.
Can you tell me what was your response? Like, what was it like for you when they told you that they were going to be injecting you with a radioactive substance?
I think probably the initial thing, and I wouldn't recommend people to go and look at Dr. Google. And I did look at something online where someone had a really bad experience with PRRT. And I guess that was in the back of my mind when I went for my first treatment. But I was really fortunate that and I think this is true of all the areas in Australia, is that the staff, the nuclear med staff that administer the PRRT, are just wonderful. And they're there with you the whole time. And if there is an issue, you're not feeling a little bit, if you're feeling a little bit nauseous, they're always there to help you. And I actually found, after my first treatment, I won't say that it was like a social outing, but there were always other patients in there with me having their PRRT as well. And I used to take books with me and my iPad, but I didn't use them. We used to sit and talk, and the time went really quickly. And I was fortunate in that I didn't have a lot of side effects. I was tired after it, but I had my PRRT, and because I had an interstate, we had to travel home, and I was back at work full time within about 4 days after having that. So I'm really, to me, it really wasn't a difficult process. It was tiring because it's quite a long day, but the staff are wonderful, and they're there with you the whole of the way. And you're usually with other patients that are having PRRT as well. So it does become a little bit, social, and you get there and talk. And I didn't find it a difficult process at all. And the benefits that I've got, being stable for 6 years with my tumours, and that's just amazing. It's I think one thing that was challenging for me was that my tumours were actually diagnosed as a neck. So I had a very high Ki-67 of 40%. So I was a stage 4 grade 3 tumour, and I'm always still treated as that. But my last biopsy I had a few years ago, I was less than 2% in my Ki-67. So PRRT has just been wonderful for me, and it has really been a lifesaver.
What have been some of the most challenging things for you, Lynda?
I think probably in the beginning, the major one was lack of information. I think probably too, because we were dealing with a misdiagnosis to start with. That was very, very challenging. Once I found the Unicorn Foundation, and I found the network with other patients, um, the that side of things really wasn't an issue anymore because I had access to accurate information, which really took a load off our mind because I knew that I had a reliable source that I could go to if I needed to get information. Very challenging trying to get a referral to a NET specialist team. I'm a person that doesn't really like confrontation, and it was very confronting having to push for the the original treatments, so the scans, but also the referral to NET specialists. That was really difficult, and I think that's something that people in regional areas struggle with because the information on NETs isn't as aware in regional centres, and I think there is that onus on the patient to try and to advocate for themselves. And you do have to be a little bit more forceful than you probably feel comfortable being just to get that referral to the NET specialist team. I think that probably is improving. I know certainly in Canberra, when I look at the people in our support group and the numbers that had in the beginning access to a NET specialist team, well, now we actually have 100% of all our support group have been to see a NET specialist and a multidisciplinary team that actually specialises in NETs. So I think we've come a long way. We've still got a long way to go, but that was something in the beginning that was really challenging, was just getting to the team that understood the cancer that I had. And once we did that, all that pressure was taken off. And I think the other challenging thing for me was being kind to myself and listening to my body. I have a very strong work ethic, and even in the beginning, I used to have chemotherapy and I'd go back to work straight after it. And I found that at work I was actually doing 2 jobs, and I became very sick. And it took for me to get very sick that and I actually had to leave my job because of it. But it took that for me to understand that, I need to listen to myself, and I needed to take time if my body was telling me that I needed to, and also to let people know that I maybe wasn't doing okay, and that I couldn't go out with them, or I had to decline some social outing because I just wasn't feeling up to it. And it took a long time to get to that stage, but I've also have a support group around me that understand that, and it's very difficult, I think, with a cancer diagnosis, that sometimes you have to let some people go and that don't understand what you're going through, because I think you have to listen to yourself, and you have to, I guess, take things out of the equation that may upset you and don't understand you. And I think NETs is one of those things that we look good, most of us. We don't look like we're sick. And because, I've been here around for quite a while now, people assume that because I look good, that I am good. And there are days where I'm, I don't feel wonderful and I'm tired. And, and there's little things under the surface that may be happening inside that people can't see. And so I think you have to be your own advocate and just say, look, hey, I'm not doing fantastic today, so I'm going to decline that offer. And it takes a while to get to that stage, but I think you really do need to listen to your body. And if you need to rest, well, rest. Your family will thank you for that later, because they're concerned about you as well. So, and I think that was probably the biggest challenge that I had after getting my support team in place, was just looking after me and being kind to me, and listening to my body.
Thank you, Lynda. That makes lots of sense. Lynda, what advice would you give to someone who's just embarking on this experience with neuroendocrine cancer?
I think it's really it's difficult because, especially in the beginning, you're in such a daze and you're numb, and it's very hard to put things into perspective. But I think the biggest things that I would say to people is our instinct is to go on the net, and the majority of sites on the net are old information that has very dire prognosis, and I would suggest to people that there's only one place that they should go, and that is Neuroendocrine Cancer Australia's website. The information is up to date, it's accurate, and it's also relevant to Australia. There's, that we have so many treatments here in Australia that aren't available in other countries across the world. Australia is really at the forefront of treatment with neuroendocrine, thanks to Neuroendocrine Australia, Cancer Australia, and it's so that would be my main thing, is to and also to get in touch with the net nurse Kate, who is such an amazing support, and her wealth of knowledge is just fantastic. And have a chat to her, and I think by doing that, it just takes that weight off your shoulders. You still have a long road ahead of you in getting treatment, but the emotional side, I think, is really important to deal with. And I think once you know that you've got that support there, it lessens some of that burden that you have. Also, try and hook up with a support group. One of the things with what we're going through at the moment with the COVID-19 is that we're actually having our catch-ups online, and some people find support groups really confronting. And I think the online one is fantastic, because you can just go in and you can listen, and you don't really have to say anything if you don't want to. And that's also where there's the private Facebook patient discussion page is excellent as well, because you can go on and you can read what other patients have put on there. But you can choose to be anonymous and not say anything and just read that. But you can also, tell your story, and you will get support from all over Australia. And we're all different in what we go through, but we're all there to support each other. And that's that's just emotionally, again, I think that's the most important thing that I found, was actually hooking up with other patients. And I think the other thing is to make sure that you have a really good support and medical team supporting you. If you feel that you're not getting the answers, or if you're not sure about what people are saying, ask until you understand why things are being suggested to you and what certain treatments are. And I think if you're not confident with your team, get a second opinion, because I think, once you have your emotions in place, but you also have a support group and a medical team behind you that you have confidence in, you're in a really good place to actually deal with what's going on, and to live as normal life as you can. And I think that's the most important thing, is to just be confident with what's happening to you. And if you're not sure, then I know it's really difficult, but try and get a second opinion, and you may have to go through another team until you find someone that you're confident with. But I think that's the most important. And just, if you need help, ask. Contact Kate, or other patients, but ask if you need help, because there's help out there. And and we can all live fairly normal lives. once we get, you know, confident in our treatment, and that our emotional support is being looked after as well. I think someone newly diagnosed too, you don't want to have a whole lot of information. You can get information overload, which is something too that I would certainly say to somebody that's newly diagnosed, is to take a second person with you all the time to your appointments, because a second pair of ears, because there is a lot of information to take in, and you do find that you miss some of it. So that's something that I would also really recommend to someone, is that you take a second person to you with your appointments as emotional support as well.
Thank you. I think that's a great note to finish on.